Nathan left me with a wonderful present because he set up a lot of what I'm going to talk about, actually. So some of these things you'll see here are probably going to be familiar with from what Nathan just talked about, and in some ways it's kind of a deeper dive into some of the same issues. I'm an instructional designer, have been for many, many years, but the problem that I'm most interested in is when people know what to do and they still aren't doing it. So in Nathan's terms of a knowing-doing gap, we know that people can have the knowledge and it still doesn't translate into action. And so that's the thing I'm most interested in, is how do we handle the situation where the person knows the right thing to do. They know they shouldn't take the needle in the cap and, sorry, I think I'm going in and out. They shouldn't take the needle in the cap and stick because they know that that's a problem, but yet, it's a habit or something is going on and they're still going to do it, and there's the risk of needle sticks and things like that. So, in our ideal world, behavior change would look like this. Oh, you really shouldn't text while driving. It's dangerous. And the person would say, oh my goodness, you're right. I will never do it again. Wouldn't it be nice if it was that easy, right? If we could just do that. But it doesn't work that way, right? Instead, we have what I refer to as I know but behaviors. I know it's a bad idea, and I never do it, except when I do, and then I feel guilty. I know it's a bad idea, but I only do it once in a while, and I'm very careful. I know it's a bad idea for other people, but I can do it because I'm good at it. Right? Is that one familiar? Once in a while, the problem is genuinely ignorance. What's the big deal? They're young, they don't have very much experience. But mostly it's not this last one, where the gap between knowledge, between where they are and where they should be is that they don't know. Now, many behaviors, if you just know the right answer and you have the right equipment, in Nathan's example about the wine glasses, that's probably enough, and people will change their behaviors, and that's fine. But then there are other things where people know, and they can, and they even have the ability, and yet the behavior is still not happening. So why? What are some of the reasons why that might be the case? What do you think? Why can somebody know what to do and they still don't do it? Habits, right? That's a huge one. Consequences, right? Motivation. Circumstances, yes, the wine glasses are a good example of circumstances. Anything else? It's easier to do something else. Yeah, right? Exactly. So there's quite a few of these reasons why these things can happen, and all the ones you've mentioned are pretty much, yes, exactly right. So one of the things that I am interested in is around the motivation issue is thinking about who's making the decision. How many people are familiar with this idea, the idea that your brain is like an elephant and a rider? Okay, just a couple. I'll explain it. So this comes from a book called The Happiness Hypothesis from a psychologist named Jonathan Haidt. And he talks about, if you think about your brain from an evolutionary point of view, we've got kind of our oldest functions like breathing and heart rate, and reflexes are sort of down by the spinal cord, and then things like vision and hearing, and in the back you've got gross motor control, and then you've got more sort of fine motor control. And right in the middle we've got the emotional limbic system, hypothalamus, amygdala, fight or flight, all of those kinds of things. And then up in front we have prefrontal cortex, which is things like executive control, impulse control, planning for the future, all of those kinds of things. And so in his metaphor, we have this elephant, which is all of your automatic, emotional, visceral brain, kind of from here back. I know I'm playing very fast and loose with brain anatomy, I understand. But then up front, we have this area of the writer, which is the conscious verbal thinking brain, logic, like I said, logic, impulse control, those kinds of things. So you've got a little rider sitting on a big elephant. And the rider makes decisions that are hopefully beneficial. I really should order a salad, or I really should get this homework out of the way, or exercising now will give me more energy later. You know, it's a very, our riders are very virtuous. Elephants are things like, ooh, French fries, yeah. Or, hey, look, celebrity chef death matches on TV. Or, I'm just gonna lie down on the couch for 1 minute. Just one, right? So as we get into this, we have our elephant, which wants things that feel good now, right? That satisfy us right now. And our rider wants things that are going to be helpful down the line. It plans for the future. And so when there's a conflict, who do you think wins? Right. My favorite example of this is you are lying in bed and your alarm goes off and you know you should get up. It's, you know, if you don't get up now, you're going to be late and you won't have time to like read stuff before, and there's going to be horrible traffic on the way to work, and you won't have time to look at your notes before the meeting, and you really, really, really should get up. And what happens? Snooze button, right? 5 more minutes, which is all elephant. Yeah, your elephant is saying, I don't care what the future consequences are. I'm interested in the fact that it is warm and comfortable and nice here right now, and the future consequences can take care of themselves. So if you've ever had that feeling where you know you should get up and you still do 5 more minutes, then you know that's your elephant making the decision in that circumstance. So what are some of the behaviors that you're hoping to change that sort of fall into this category? Things where people know the right thing to do, but they still aren't doing it. Who's got one? Hand washing. Yes, absolutely. That is a really classic one, isn't it? Mm-hmm. Anything else? Nobody has any of these? You're so lucky. Eating well? Yeah. So making better choices about eating and things like that. Exercise, right? Absolutely. Smoking. Mm-hmm. How about in your audience with the people that you're trying to create training for? Are there some behaviors there that you would really like them to do or do better than they do right now? Sorry? Oh, having people in the audience come back for the follow-up subsequent vaccination. Yeah, absolutely. You got them for the first one, now they need to come for the booster or the follow-up. With attitude for the health workers. Yeah, there's lots of stuff there to unpack, I bet. All right. Okay, so we've got some of these kinds of behaviors that we're hoping to change. And so just the first part, as Nathan refers to, is really having a good definition of what we're talking about and making sure that we're talking about an actual behavior. Because when we think of things like diet, we kind of know what that means, you know, having a better diet or exercise or healthier lifestyle. But the more concrete we can be about the definition of the behaviors, really we need to do that as a starting place. So walking for 20 minutes, is that a clear behavior? Every day? Sure, yeah. How about delivering patient-centered care? Not so much, and I get that a lot. Like I'll start a project and I'll get things like, we want better patient-centered care. And I'll ask the question like, okay, what are the behaviors that support better patient-centered care? Like, what does it actually look like when people are doing it? And I won't go through all of these, but one of the things I often find myself asking is if I took a picture or a video of somebody providing patient-centered care or somebody engaging with the community, what would I actually see on my photo or my video? So let's talk about that one. I know that it's part of some of the curriculums around how do you engage with the community around an immunization effort. If I took a picture of somebody engaging with the community around immunization, what kinds of behavior do I see? Yeah, so they would be able to do a good explanation of the process or some of the information behind it or something like that. Listening, right? Yeah, a listening behavior where they're actually listening and then, yeah, smiling, like physical affect when they're talking to people. So we've got some, find some concrete behaviors in there, and then we can start to look at what is it going to take for that behavior to actually manifest. And so one of the questions I usually ask is, where are your learners getting stuck? And this is modified from some risk assessment trees that are done out of some researchers out of the UK. This is my sort of more general version of it. The ones that they had worked with were specific to certain behaviors like smoking and texting while driving. But is it the problem that they don't know about the behavior? They genuinely don't know. We're starting from a point of complete ignorance. The problem that they know about the behavior, but they don't understand why it's important. So they got told somewhere along the line, but they don't really understand why it's important or what the consequences of it are. Or do they understand the explanation for why it's important, but they just don't believe you, right? You've said, hey, it's really, really important to tick off certain things on this chart, and they understood what you explained to them, but they're like, I'm busy, I have way too many other things to take care of. This chart, I just don't believe that this chart is as important as, taking care of this patient or something like that. They accept that the behavior is important, but they just don't care enough to do anything about it. Just similar. They think that it's worth it, but not a priority at the moment. And this is a tough problem, right? Because we all have this every day. I've got, 9,000 things I could do today. I have to pick 7 that I've got time for. And so where does this particular behavior sit in the competing priorities of problems and things like that? So hand washing, we know it's incredibly important, but if a patient is actually in significant distress, you may decide that it's more important to help the patient than it is to wash your hands, even though it has kind of bigger, longer-term consequences. Thinks the behavior is a priority but doesn't know how to do it. Thinks the behavior is priority but thinks it's too hard in the environment, what Nathan was referring to as backdrop, so physical or social environment. So that would be the case for our flight attendants again, where they may have been totally on board with putting it in the right wine glass, but they were right, it was too hard because they didn't actually have the right glasses. Thinks the behavior is priority but isn't confident about their ability to do it. With our hand washing behavior, there's the issue of saying something to a colleague who hasn't been doing proper hand washing. But that's obviously a very difficult thing to do, and sometimes people aren't confident that that conversation will go well or that they can, kind of bring it up with somebody easily. Is ready to try, but is having a hard time getting started. So I think one of the behaviors we mentioned was exercise. So if somebody's like, I want to exercise, I'm ready to do it, I'm ready to make it a priority, but I don't really know what to do to get started. I'm not sure what's going to be the thing that I can do. Has started or is having trouble staying motivated. Is continuing but isn't consistent or successful. Has been consistent or successful but is falling off the behavior. So if we look at this and we think about where some of our learners are in this spectrum with a particular behavior, then the response needed is very different than if they're at number 1 or number 2 versus if they're at number 8, for example, right? So if they know all about the behavior, but they don't understand why it's important, that's a different problem than they think it is important, but they're not confident about their ability to do it. And you need a different solution for those 2 circumstances. So number 2 is about understanding the consequences. Number 8 is about giving people probably practice in a safe environment so that they can build up some confidence around it. So we start to have very different solutions depending on where in the spectrum different learners are in terms of where's the problem existing. So once we move beyond this, when we start to think about it, we've got this model, which I want to talk about in a moment. Is anybody familiar with this one? COMBI, it's from Susan Michie. It's based out of University College London Center for Behavior Change. Nope. Okay. So what this model looks at is it looks at the question of capability, opportunity, and motivation as being prerequisite or ways of analyzing a particular behavior and taking a look at solutions. And I'll dig into each one of these in a moment. This particular model came about because Dr. Michie and the people at UCL found that there were little behavior change models popping up all over the place, but what they wanted to do is to try to find something that was more comprehensive way of looking at a behavior change problem. And so they did a fairly massive kind of literature review of everything that was happening in behavior change, so pulling from domains like public health, safety, individual kind of behavior change like healthy eating or exercise or any of those kinds of things, and brought it into a single model, which I'll talk about here. So COMBI, when we look at capability, they break it out into physical capability and psychological capability. So for example, physical capability is, can they actually execute the actions? Do they have the physical skills, strength, or stamina to do it? Psychological capability gets into things like, it gets into knowledge, it gets into skill development training. It also gets into things like, is it a self-regulation problem? Do I need to exert willpower? That would be considered to be part of psychological capability. Do I have the ability to kind of keep myself on task and execute for those things? Then we get into what Nathan was referring to as the backdrop, which is physical opportunity and social opportunity. So physical opportunity is, does my physical environment support what I need to do? So if hand washing is a priority in a clinic, is the clinic well set up to support hand washing, or is hand washing difficult because it's too far away and kind of out of the flow of things and so forth? Social opportunity gets into social cues, and again, Nathan brought that up as well. So do I see other people modeling the behavior? If I do the behavior, will my peers support me? If I do the behavior, will my manager or the head of my group support me, or whoever is around me? Do I have the opportunity to see somebody else doing the behavior? All of those kinds of things. Then for motivation, they look at two kinds of motivation. Reflective motivation, which is the sort of deliberate conscious motivation on the part of the learner or the person. So is it even a goal for them? Do they consider it to be something that they value? Do they consider it to be something that they have a deliberate structure or plan around? And then automatic motivation is all of the elephant stuff. The habits and the feelings and the unconscious biases and all of the things that you're sort of are a little bit more below the surface. So if I look at an example of this, I was working on a project for construction workers to be safer. So we wanted construction workers to not get injured on construction sites. And so one of the behaviors that we had looked at for construction workers for being safe was reporting safety problems when they see them. So that's the behavior. When a construction worker sees a safety problem, they should report it to somebody, right? So let's take a look at physical capability. Do they have the physical capability to do this? Mostly, yeah, that's probably not our big problem. Mostly it should be fine. We do have, in the US, we do have a lot of construction workers who are not necessarily native English speakers. So they're from Mexico or from different places. And so there may be like a language barrier issue that kind of comes into play. But by and large, they should have that capability. Psychological capability is, well, what do you need to be able to do psychologically to be able to report construction problems when you see them? What's that? Yeah, right. You should be able to recognize the problems when you see them and then know what the action is you need to take. So there is a learning component there. I need to know, that sitting next to that could be a safety problem, or things like that could be a problem. So you need to be able to recognize it. So there is a knowledge learning piece to this, right, around that. But what else happens? So you're a construction worker, and you see a problem, and you go to your boss, and your boss is not at all happy because you're going to shut down the construction site for 3 hours if you tell them about this safety problem. So what does somebody need, what psychological capability does somebody need to have that conversation and have it turn out well? Motivation, yeah, but what do they need, what do they need to be able to do? Clear directions. Yeah, there's a communication piece to it, right? And a negotiation piece. There are better and worse ways to give people bad news. And if you don't know good ways to give people bad news, what are you going to do? You're just not going to, right? It'll be fine. I'm just going to keep going because I don't want to get yelled at. So what we find when we start to do COM-B on this is that we've probably got some communication skills that we need to help people develop if we're going to get them to report safety problems on a regular basis. How about physical opportunity? Does that come into play for reporting safety issues? It might, right? Yeah, there's different ways that it can. We went out to a site visit yesterday, and I was seeing the vaccines where the thing changes color if it gets exposed to heat. And so that's a way of fixing a behavior change problem partially through changing the physical environment. So if you've got something in the environment that prompts you to go, oh wait, we have a problem here, that can actually improve the behavior at that point. So physical opportunity can do that. And if the safety problem I see is that somebody's working up high and they don't have the right harness on, if the harness is right here in the truck, ready to go, then it's easy to report that problem. If the harness is back at the shop and it's going to be 20 minutes for somebody to drive there and come back with the harness, then maybe they're going to be more reluctant to bring up the issue. So if the solutions are close at hand, it's probably easier to report the safety issue. So the physical environment could come into this. How about social opportunity? How do you think that would impact somebody's ability to report safety problems? Yeah, where they are in the hierarchy, right? Absolutely. So, are they somebody who feels like they can go talk to the boss, or not so much? Yeah, relationship with their supervisor. Oh, what's that? Type of supervisor? Yes, absolutely. So the culture comes into play in a big way, right? If you work at a company where they go, thank you so much, that's great, I appreciate that you reported that, versus, oh, you get yelled at. It's going to be very different behaviors. Also, what you see in terms of behaviors that your colleagues are modeling, if they report safety problems, you're probably going to report safety problems. If they don't report safety problems, you're probably going to take your cue from that and go, okay, not so much. So the social factor is going to come in big, be a big influencer here. Now, reflective motivation is, do they have goals around this? So one of the questions we asked when we were doing research with the users was, who is most responsible for your safety? And we gave them a choice of them, the company, the safety supervisor, their manager, and really the right answer should always be them as being the one most responsible for their safety. And it was not always the answer that people put on that, which says that some of the people on there seem to think it's something that is outside of their responsibility. It's a responsibility that somebody else has, not them. And so that's something that we had to address when we started to do interventions, was here's why this is your responsibility. We also looked at the question of, do they have goals around it? Do they have a specific goal or reason for wanting to stay safe? I would like to be, so we did some activities around, I would like to stay safe because I want to see my kids graduate from high school, or I want to go to my kid's soccer game, or I want to go fishing this weekend, or whatever the reasons are. Also, under professional motivation, did they consider getting better at safety to be part of their professional development? Because some of these people are very skilled tradespeople and they take pride in their abilities, but do they even see safety as something that's part of that, as part of being better at their jobs? Because a lot of people see it as, I have to follow compliance. So our pharmaceutical rep example, you know, did she see, you know, that compliance as being part of being a good pharmaceutical rep, or did she just see it as a barrier in the way of making sales, things like that? And then our last one is automatic motivation, which is habits, which is feelings, which is unconscious issues, unconscious bias, things like that. How do you think that might play into this example? Yep, yeah, so having the right motivation around it and having, you know, some issues around what is the feeling around it or what is the motivation for it. Yep. Yeah, so probably they have some old habits to undo. If they're not used to reporting these things, they need to actually undo the old habits around ignoring stuff and just kind of moving on. And probably there's just always going to be that reluctance, that feeling of discomfort at the idea of I'm going to go give somebody news that's not going to make them happy, and especially if they're, you know, if they see it with some other coworker, the idea that telling on the coworker or, you know, getting them in trouble is a problem, or, you know, things like that. So within the COMBI model, these all translate over into mechanisms of action, and I'm not going to get into a great deal of this, but with motivation, we look at things like values, goals, intentions, belief about their own capabilities, belief about consequences, perceived susceptibility or vulnerability. A lot of it is what do they think the risk really is, their self-image, optimism. So there's a number of different variables, and we can make these available to people. I don't want to dig into all of these, but each one kind of drills down into some subcategory ranges. And then the intervention functions that are identified as part of this model are education, which is really knowledge, training, which is more skill development and is going to be more of the hands-on piece, persuading people that it's really important to, you know, report safety issues, incentives, coercion, which is there will be a punishment, restriction, so if you can't do this behavior, we'll just take this responsibility away and only managers can do it from now on, would be an example of restriction. Environmental restructuring, so changing the physical environment, performed by other people, and enablement, which is kind of a catch-all category for other ways that you can support it. And so each of these will map to certain problems. I don't think this is a perfect table, but it's potentially useful. But anyway, the ultimate piece for this, and this is actually something free if you're interested in it, is they have 93 different interventions around behavior change problems that they've pulled from the research literature and tried to create a coded taxonomy of it. There's actually a free app for smartphones that you can download. It's BCT Taxonomy, and it has basically everything from all of the different literature pieces of the academic research around different behavior change to identify a number of different solutions. When I do a full day workshop, we get all of this, but I'm just going to give you the reference for now. But it looks at different categories. So is goal setting, what are solutions around goal setting, what are solutions around feedback, social support, shaping knowledge, natural consequences, comparison of behaviors, association, repetition, substitution, a number of different solutions that have been tried. So I want to just spend the rest of my time taking a look at some really common problems that I see when I'm talking about this from a learning and development point of view. The behavior change, the COMBI, it's also referred to as the behavior change wheel. So if you look for that, you'll find that as well. I have a shorter list, because that's a big list. I have a shorter list of really common issues that I see when I'm breaking down a behavior change problem and kind of thinking through potential causes for it. So if we think about these, we're really kind of thinking a lot about the elephant, because ultimately what happens is while the rider makes all sorts of plans, the elephant is usually the one who's sort of deciding what happens in the moment. So I sometimes refer to this as talking to the elephant. And so these are common reasons, and you do have this list in your participant guide. I'm going to go through each one of these, but you have it for your reference. and I'm going to just talk about these. So I think the single biggest issue that crops up, and I've never seen a real behavior change problem that didn't have this, is either absent or delayed feedback, specifically some kind of visible feedback in the circumstances. So if we think about our hand washing problem, how's my hand look right now? Looks pretty good, right? Is it clean enough for medical purposes? Clearly not, right? And you all know that. But once I wash it and it is clean enough for medical purposes, will it look different? No, probably not, right? I mean, if you scrub for surgery, I think it gets a little red or something, but that's about it. So who knows that my hand is not clean, the rider or the elephant? Yeah, it's pure rider, right? The elephant's looking at it and going, hey, looks pretty good to me, right? So the decision that hand washing needs to happen is happening purely on the rider side. Now, we all know that sometimes riders are little and elephants are very big, right? Yeah. So the rider can kind of keep the elephant going for so long, but eventually riders get tired and the elephant kind of takes over. So it's the end of the long day and exhausted and there's a lot of things going on and all of a sudden some things can start to slip. Now I think that part of the problem is the elephant is like, I really think your hands look okay. I think they're fine, right? It's a perception issue. I think if our hands turned blue when they had bacteria on them, we wouldn't have nearly so much of a hand washing problem. Because you'd look and you'd be like, oh, blue, I've got to wash my hands. And, like there wouldn't be really much question about it. So one of the reasons that this is such a difficult and persistent problem is there's this lack of visible feedback that makes it concrete, essentially, for the elephant as opposed to the rider who understands germ theory and understands about bacteria and things like that. So some of the solutions around this, and this shows up in almost every hand-washing curriculum in one form or another, is how do I make this visible to the elephant, right? We've all seen this. You've seen lots of hand-washing curriculum. This is the one I happen to like where they painted the patient green and then just showed where all of the green paint went when, different people touched them. And so you're taking something that's invisible to the elephant and you're starting to make it more visible to the elephant. Or it could be the black light, or it could be, there's different exercises. But what you're trying to do is take something that's conceptual and make it physical for people. Because as Nathan pointed out, that physical engagement piece is probably part of the puzzle. Other ways to make behaviors visible. We talked about rubrics and things like that. This is a rubric for time management. And so what this person did, Francis Wade, he has a book called Perfect Time-Based Productivity. What he did is he did the detailed work of figuring out what are all those little behaviors that are involved in good time management. And so for this part, he talks about one of the big behaviors is you just need to capture all the things you need to do. You need to capture all the tasks. And he figured out that means carrying some way to capture the tasks with you, whether it's your smartphone or a notebook or an organizer or what. Actually using it, not just carrying it around. Consolidating them periodically, so taking the things out of email or off of text messages or something like that and putting it into my single list, and then having some way to back it up if need be. And then what he looked at is he's like, okay, are people doing this behavior rarely or never, sometimes, often, or always? And so when he sits down and works with somebody on their time management, they can fill this out, and he uses white, yellow, orange, green, like karate belts kind of thing, as a way of seeing it. But he can actually figure out where are the behaviors in this big thing called time management, which little behaviors are the things that are letting this person down and they're causing the system not to work, and can start to actually get some feedback. And then he updates these when he meets with them so that he can see where progress is being made and where people are actually improving or what parts are still difficult for them, and they can troubleshoot those. But instead of, oh, the whole system's not working, they can be very specific about which actual part of the system isn't working because they track it in this format. there also seems to be something really important about having visceral experiences in behavior change. There's a bunch of research that's going on. The primary person doing this is somebody named Jeremy Bailenson, who is at the Stanford Virtual Reality Lab. And he's doing really, really interesting work around behavior change and using virtual environments for behavior change specifically, but I think some of the principles carry across. So what he was looking at, this was a study they did, where he was looking at using disposable paper, right? So paper napkins or paper towels or things like that, and using too much disposable paper and getting people to use less, right? Obviously, healthcare's got its own issues, but just in the bigger world, not using quite so much paper that you throw away. And so what they did is they did an educational component, which is that knowledge piece about if you use this much paper, here's how many trees get cut down. And then he divided the groups up into two parts. So one group went and read about cutting down trees. So it was a very cognitive experience, right? They're reading stories about cutting down trees. And the other group went into this virtual reality environment where they had a virtual chainsaw and they cut down virtual trees to see the impact of the behavior that they were doing. So if they continued to use this much paper, here's the things that were going to happen based on that. And so what happened at that point is they came out and both groups basically said, yes, I should use less paper. So, and in about equal numbers, both groups came out with the same intention to use less paper. But who's talking about intention? Is it the rider or the elephant that kind of does future intention, my behavior in the future? Yeah, it's purely rider, because the rider is really the only entity in your brain that's capable of that future projection. Your elephant has this present bias. So both groups said, oh, I should use less paper. But then they would spill a glass of water as people were leaving the room and then count how many paper towels people used to mop up the spill. And the people who had been in the more visceral condition, where the elephant actually got to experience trees being cut down, used almost 20% less paper than the people who had been in the more cognitive condition. So it seems, and I don't want to overgeneralize too much from one piece of research, but it seems there's something about really having the experience that changes behavior, not intention, because you can change intention lots of ways, but actual on-the-ground behavior seems to have something to do with having a visceral experience around it. So when we were interviewing the construction workers for safety projects, if a construction worker had had an accident, let's say with wearing protective eyewear, do you think that that construction worker ever forgot their glasses again? No, right? And we found pretty good response from people if they even just knew somebody who had had that accident. But when it started to get a little bit more distant, so it's not somebody you know, but maybe a few chains down and things like that, the suspicion is, and I don't have great data behind this, but the suspicion is that there's a diminishing effect the more distant it is from you and the less real it feels essentially to your elephant. And it's not just, kind of the amount of feedback. It has to do with when you get it as well. So what's better, $10 or $11? If I'm giving away money, I'm not, but if I'm giving away money, how many people would rather have $10? $11? All right, excellent. Okay, second version of this question. I will either give you $10 today, I won't, but pretend. I will either give you $10 today or $11 tomorrow. How many people want the $10 today? How many people are holding out for the $11 tomorrow? Okay, I'd say that was about 60-40, right? So the 40 people, good use of rider to restrain your elephant, right? To sacrifice an immediate reward for a future gain. Okay, last version of this. I can either give you $10 today or $11 in a year. How many people want the $10 today? Anybody holding out? I sometimes get one person and then they want to talk to me about interest rates. So that's a pretty consistent result. If the reward happens right now, of course we want the bigger reward. If I have to start waiting for it, I start to discount the value of that reward. And the further out in time that it goes, the more that I discount it. It also works for tangibility. If the reward is somehow intangible, then I'm going to start to discount the value of the reward. And the term for this is hyperbolic discounting or temporal discounting. So whatever I get right now is most valuable, and then I start to see a fall off. Whether it actually goes in a that clean a curve or not is probably open for some debate, but nonetheless, the principle holds. So almost all of the behaviors that we have trouble with as humans have an element of this. So one of the behaviors people brought up at the beginning was exercise. If you start exercising today, you're going to start an exercise program. How long is it going to be before you start to see some physiological benefits from that exercise that you can recognize? 2 months? Yeah, 6 to 8 weeks, maybe even 3-4 months, depending on the intensity of the exercise. Okay. Yeah, that's a long time for your elephant to wait. Right? You're going entirely on rider until there start to be some visible changes that cause your elephant to kind of go, oh wait, this is nice, right? How about eating? We all had breakfast. There was the buffet, right? And it had like the donuts and the cakes and all of those kinds of things. If you eat a lot of those things, how long does it take for that consequence to show up? 1 week. Yeah, we have an authoritative answer over there. But it's still delayed, right? Yeah. How many of you ever have been, whether it's some kind of family function where you have a big meal, right? Big, huge meal, and you know that you've eaten enough. You know that you've eaten enough. And then you see that there's one last piece of, in America it's Thanksgiving, that's the big one, right? And there's always that last piece of pie sitting there. And you know you've eaten more than enough. And in 10 minutes, if you eat that pie, you're going to be sorry, right? Anybody ever had this one? Yeah? Okay, I got a couple hands. Right. How many people still eat the pie? I'm right here. Yeah, exactly. So even 10 minutes delay, you know what the consequence is going to be. But who knows it, rider or elephant? The elephant knows the pie's going to be delicious right now. The rider knows that in 10 minutes you're going to be sorry that you ate that, right? So even 10 minutes delay is enough to sometimes discount the consequence of it and let the elephant make the decision around it. And as I mentioned, tangibility too, right? So if I started smoking today, what's the consequence? I don't smoke, but if I started today, what would the consequences be? What's that? Cancer, right? Death, and things that cause death, right? And usually your elephant would help you avoid death. That's one of its jobs. But what's the problem there? When might I get cancer if I started smoking today? 10 years, 20 years, something like that. And it's not certain, right? I think I looked it up at some point. It's about 1 in 5. Smokers actually get lung cancer. And there's emphysema and, other things that, and heart problems and other reasons not to smoke. But it's delayed enough. So if you push the consequence out 20 years, even if the consequence is death, your elephant can discount it enough that they don't take it seriously. So, hand washing. How do people see the consequences of hand washing when they don't do it? They mostly don't, right? Because if a patient on the ward gets sick, they don't really know that it was their hands that caused the problem, that caused the issue, right? Because lots of other people were interacting with this patient and family members came to visit and all of these sorts of things. So there's the issue of the rider's kind of making it happen, but the elephant almost never sees the consequence. Another issue is places where the consequence doesn't show up individually. So if we eat the donuts, do you see the results of, do you personally get to see what the consequences are of it? Probably you do, actually. That one, you step on the scale and you're like, oh, look, there's more. But it's delayed, but you still see it. But hand washing, where do the signs of hand washing problems become visible? Yeah, it might be at the group level, you know, like rates of infection on the ward or something like that. It might be at the system level, this hospital's infection rates versus this hospital. So when you have that disconnect between the individual level of the behavior and the visibility of the consequences of the behavior, so the behavior always happens individually, but sometimes the results of that behavior don't show up until group or system level, you're always going to have behavior change problems in that space. That's going to be one of your really typical answers of places where you're going to have a hard time dealing with that behavior. I talk about, I was just reading some things about the gender pay gap in the US because men often get paid more than women do for the same work, and they're trying to address it. But one of the difficulties with it is that the places where that behavior happens is usually this one person and this one person negotiating salary. And there's always a reason, right? There's always, they don't have as much experience, or you know, they don't have exactly the right skill set or something where they can justify what they're paying that person. But the results of that, the fact that it kind of is systematic, don't show up until probably the system level where we start to see, you know, disparities in terms of salary gaps. And those are often very hard problems to change. So another big issue just is the competing priorities. We all have far too many things to do in any given day. And so we all have lots of behaviors we want these people to do. And so really that one's just a tough one. That's just part of the world. And so it does involve prioritization. Is hand washing more important than these other 9 things that somebody can do at that time? And if it is, that's great, but then it may need to be spelled out explicitly for people, or people may need help coming to that conclusion for themselves. Because there's always too many things. Unclear goals. So that's another issue that we see, is when the goals are not very clear. So improving customer service, giving better feedback, being healthier, those are all good things, but they're not specific behaviors that people can drive towards. So that's an issue that's one of the problems. Unlearning an old behavior is a real challenge for people too, right? We were talking about this the other day about in the US we drive on the right-hand side of the road, and so whenever I come to countries where they drive on the left-hand side of the road, it's always a little bit of a, okay, I need to reorient, right? Because I have to unlearn my behavior of where are the cars coming from and things like that. Fortunately, I do not have to drive here, so I'm quite happy to not have to deal with that. But the process of getting skilled at something and becoming really good at it kind of goes through familiarization, comprehension, conscious effort, conscious action, proficiency, unconscious competence. There's a few different versions of this. I happen to like this one. So if I'm learning to drive, familiarization's just like steering wheel, brake, gas, you know, things like that. Comprehension is I understand all the steps to the act of driving. Conscious effort is when you're trying but not necessarily being completely successful. So when I was learning to drive, my dad would take me to this parking lot on a Sunday afternoon that was completely empty. There were no other cars, so even if I screwed up, I couldn't hurt anything. Conscious action is when you can start to kind of complete the task. You can go all the way through, and it may be very slow, but you can kind of perform the whole thing. So that was about the point where he actually let me go out of the parking lot and like drive around the block or something. Proficiency is when you're getting pretty good at it. It's not great, but good enough, and that would be about the time where you could take the driver's test. Then unconscious competence is when you've so internalized all of these tasks that you don't have to think about it anymore. So, anybody ever done the thing where you drive home from work and you pull into your driveway and you realize you totally don't remember the drive home at all? You know that one? A few people nods, right? That's that feeling of unconscious competence. And what it actually is that your brain has actually shifted the place where a lot of that information is stored, and essentially you can do those tasks without paying very much conscious control. So if you're driving and there's no other cars around, you can lower your rate of attention. But then if you get into traffic, you raise your rate of attention. And so you will actually deliberately control this. I will sit in unconscious competence until I need to bring it up a little bit and start to pay more conscious attention. And then I'll ramp it back down again. And you're always making decisions about that. Yeah, you don't get to unconscious competence without practice and repetition. Yeah, there's no such thing as like shortcutting that. You have to do something many, many times before you can do it without conscious control. So, and this is typically how people learn skills and get good at them. This is one of my favorite studies. This is your brain on Tetris. Does anybody play that, the little video game where you drop the blocks? Yep. So what this is it's a PET scan, so it looks at glucose metabolic rate for somebody playing Tetris for the very first time. So it's a pretty intense activity. There's a lot of blood glucose being expended and a lot of effort that's going on. And this is the same person after they've been practicing Tetris for about 6 weeks. And so one of the things that happens when you automate those skills is it basically lowers the level of cognitive effort that's required to perform those skills. So your people who have been doing immunizations for years are going to be very much able to do it without expending a lot of cognitive effort for the particular task, and they're going to just be pretty automatic about it. But if you change something about their process and you take them back over to this, what happens? Because automatic, you want to do things without having to think about them, so you're going to always want to do them the same way. So what happens if you change something? Yeah, and it feels uncomfortable, right? Yeah, it's one of these things. And people who are very good at things, there's a certain amount of ego part of that expertise. That's part of my pride in my job, is that I'm very good at things. So if you take somebody from feeling like they're good at something to feeling like they're not so good at something, what happens? Confidence? People get grumpy, right? And you're dealing with some deep things. You're dealing with their competence as a professional and their ability to kind of function. So when you're changing things and you're taking somebody from feeling like this, so this is my brain when I drive in the US, but if I had to drive, here, it would be much more like that. I also wouldn't, because I think it's scary. But every time we make a left turn, I think I'm going to die. So I can't do it. But undoing the old behaviors in some ways is harder than having learned the behavior in the first place. Because not only do you have to learn the new thing, you have to fight against the old impulses that you had on this. So what do you think you need to do to make that person more comfortable with the new behavior? You had the answer before. Right, yep. So they're used to being up here. They're used to being very competent at what they do. And you've brought them down to here. Now, what happens if you leave them there? If that's the end of the learning experience where they go, it's terrible, right? Yeah, what are they going to? They're going to try to climb back up the hill, right, to get back to where they were before. They're going to try to go back to the old behavior. So what you need to do is if you take them from here down to here, they need to have enough practice that they at least start to see the upward curve. Because they don't have to get all the way back up to here. They can do that on the job as long as it's supported well. But if they leave here, where do they think the trajectory is still going? It's just going to go down from there, right? So if you leave somebody on the downward slope, they are going to go, wait, I used to be good at this. I'm going to go back to the thing that I used to be able to do. But if you can give them enough practice that they start to actually see their own improvement, even if it's just a little, but they can say, oh, it's getting better, then you leave them in a place where they're in an upward trajectory, and they'll get back to their level of competence if they're doing this stuff frequently. But one of the big problems with that is if you're unlearning an old behavior and there's not enough practice of the new behavior to start to feel a little bit more confidence and to see a little bit of improvement, that's a tough, tough place to leave people. Yeah, you can do that. I mean, if you're going to change something, change little things so it doesn't interrupt them as much, as opposed to big system change. Sometimes you can't. Sometimes that's not how the world is set up. But I would definitely, if you can, change a little at a time so you don't interrupt people quite so much. I'm all in favor of that. Because we really, like, learning to ride a bike is wobbly and hard, but then people feel really good at it. But when you ask them to kind of get off their bike and start walking it up the hill again, they don't like that so much, which is reasonable. Sometimes the problem, as we keep going through our list, is unawareness of consequences. So I found out recently that if I take milk cartons and I flatten them too much, they get sorted wrong when they go to the recycling place. They wind up with paper instead of winding up with cartons. So I actually don't flatten them all the way anymore because it's actually better to not do that. That's fine. I just didn't know what happens to this stuff when it leaves my house. And so all I need to know is, here's what are the consequences, or here's what's the downstream stuff. And that was enough to change my behavior in that particular instance. Lack of environment or process support. You know, I'm ready to get started with a new method for patient-centered care, and great, you just need to fill out these 25 forms to get started. You've never seen that happen, right? But if we put too many roadblocks, one of the things with behaviors is making the new behavior as easy as possible to do, as opposed to making people really, really motivated. It turns out we're probably better off making it easy than we are trying to motivate people, because motivation is kind of exhaustible as a resource, and you know, you have to really have the elephant on board. Whenever we're thinking about these things, increasing motivation is part of it, but lowering friction is part of it. So in the example of the medication vials that we saw yesterday, where the color changed to indicate that it had been exposed to too much heat, right? I think, yeah, okay. That's a case where you're making it much, much easier for people to do the right behavior, which is discard vaccines that are now ineffective, right? And so instead of being like, getting people to be really, really, really motivated about it, we can just make the behavior much easier to do, and that's probably ultimately going to be a more successful strategy. You can do both. There's nothing wrong with both, but we shouldn't rely just on motivation. We should also try to figure out how do we make the behavior as easy as possible. Sometimes changes in the environment can have a really big impact. I've done some workshops for Google, and if you go to Google, one of the best things about going there is that the food is really good. And they have these kitchens, and they have snacks in the kitchens, and they used to have these machines where you could get M&Ms. So you open it up, and you put your cup, and M&Ms basically fall from the sky, and you have as many as you want. But they had a problem where people were putting on weight the first year that they worked there, and nobody was that happy about it. And so they said, well, can we make some changes to the environment to help people make healthier choices about food? So if you were going to make this less appealing to the elephant, not take it away, we don't want to take it away, but if you want to make it less appealing to the elephant, what would you do? Yeah, and actually in some of the, that's not what they did here, but in some of the Google places, they have just little packets. So you just get a packet with a small number of M&Ms. And you can take more packets, but at least it sort of implies you should only take one. Anything else? Change the color, right? The elephant's like, ooh, shiny, pretty colors, right? That's very appealing to our elephants, right? So, okay. So what they did is they put them in these opaque bins, right? So instead of it just falling, where you can't regulate the amount, you can regulate the amount a little bit more carefully, and it's in an opaque bin, so you don't, your elephant isn't triggered by the sight of the M&Ms. You can still have them, you just have to make a conscious decision to have M&Ms, right? That that you want them. So how much of a behavior change impact do you think this had? What's that? 20%? Yeah? Okay, good theory. I actually don't know what it is in terms of percentage, but in 7 weeks, New York Googlers consumed 3.1 million fewer calories from M&Ms. You know? So that one's a pretty big one. They did the same thing with sugared drinks. So you can still get a Mountain Dew or a Coca-Cola or something with sugar, but it's behind the frosted pane at the bottom of the cooler. And the stuff at eye level is all water, like water with flavor, but it's all 0 calorie kinds of things. And so they significantly reduced the consumption of sugar drinks by just making it a little bit harder for the elephants to see, right? It's the exact opposite in the US of how the cereal aisle works. Which is entirely about getting small children to want, we were talking about Fruit Loops at breakfast, but so these little things can actually have a pretty big impact on behavior. Another one is anxiety, fear, or discomfort. The elephant is worried about telling their manager about the safety problem. It's just stressful, right? They just feel anxious about it. So what kinds of solutions would help with that if somebody's worried about doing something? What's going to make the elephant feel a little bit better about it, if anything? Yeah, encouragement. So, getting a message from somebody that it's okay. Probably, this is another place where practice in a safe environment is going to help too, Like if you actually do the action and you practice it a few times, it can really help. Lack of confidence. Can I do it, or can I do it, question mark, or I can do it. If people feel confident in the new thing, they're more likely to do it as well. And so ways that we can do that is practice. This is from it's a drug and alcohol prevention curriculum for middle schoolers, about 12, 13-year-old kids in the US. And what they found is that knowledge about how bad drugs were didn't really change behavior at all. Because again, that's rider, it's not elephant. But when they looked at it, they said, well, the key point where these kids need to use this behavior is when they're in a social situation and somebody says, do you want a cigarette, or do you want a beer, or do you want something? How do they manage that? And there's a lot of anxiety and discomfort because it's socially awkward, and they need to feel confident that they know how to handle it. So the curriculum was based entirely around, not entirely, they did some other stuff, but the core of the curriculum was practicing handling social situations and knowing what to do when that time came. So they did skits, they did role plays, they did a lot of practice kinds of things, they created little movies, they did all sorts of stuff around practicing handling that particular situation. Social proof, Nathan talked about this as well. What do you see around you? What do you see other people doing in your social things? You know, we do a lot of like, hey, what are those elephants doing over there? Something good, right? One of my things is, one of the questions I always have when I'm in a professional context is if you're sometimes having a meal, is it okay to order wine, right? At a particular dinner, if it's a work-related thing. Socially, I know what to do, but if it's work. And so I was at a dinner at a conference, and everybody had a reason they weren't ready to order yet because nobody had figured out what was okay. And finally, the host was like, I will have a glass of Merlot, and I will have a salad, and I'll have soup, and I'll have this. We were like, thank you. Thank you for establishing the social norm. Now we know what to do. Good, okay. So we do this all the time. So when new healthcare workers come into your settings, they're going to look at the experienced healthcare workers and say, what's the right norm? What should I be doing? And so if those people aren't modeling those behaviors correctly, then the new people are going to come in and learn that the behaviors are not useful. So Nathan's example about the pharmaceutical rep, well, you know, this is what she was told officially, but she sees all of her colleagues, you know, distributing this paper. That's the social norm. That turns into what's okay. Really, that's what she's really learning is okay, or what her elephant is learning. We listen to authority figures, but they have to be the right authority figure. So in the case of the kids and the drugs and alcohol, maybe they'd listen to parents, maybe they'd listen to teachers, maybe they'd listen to police officers. We have drug prevention programs that involve police officers. But really, it turned out when they did the research that the thing that they listened the most to was 16-year-olds. So if you're 13, you're looking slightly aspirationally. You want to look at somebody who's just a little bit ahead of you, because when we say the term role model, we mean someone upon whom I can model my behavior. Who can I see doing something that I can model my behavior on, that that I can reliably then, you know, kind of fit into the norm and things like that. So making more opportunities to have the appropriate role models showing the behavior is a big part of influencing the elephant. So a lot of the social norming research looks at this. Can we create new social norms and things like that? George, how am I doing? Okay. So making success stories visible and establishing norms about what's acceptable behavior is actually a really powerful tool that gets used quite a bit around behavior change. How can I see people who look like me but are a little bit ahead of me actually modeling the behavior, as opposed to, you know, I mean, it's not a bad thing to have the most senior person endorse the behavior, that's fine, but I can't model my behavior on that person because we're in very different roles. So can I see someone who I can model my behavior on? And then another big piece of this is lack of autonomy or ownership. When we look at motivation models, motivation seems to be comprised of, this is self-determination theory is the model, but the idea that I like to be autonomous, I like to have control over my life and circumstances, I like to feel competent, I like to feel good at things, and I like to feel a sense of social relatedness to the people around me. And this is probably the dominant motivation theory that we're dealing with right now. And so when I have this feeling that I do not have any autonomy in the environment, people will resist that. So the compliance-related pharmaceutical example would be a case where somebody doesn't have, autonomy to make judgments about what their doctors need or things like that. And, in highly regulated environments, sometimes people can't have perfect autonomy, but are there circumstances where they can make active decisions about things? Can they have pride in a new skill or ability, happiness in an outcome, a feeling of confidence or mastery, a sense of relatedness? So sometimes it can be even little things. I was talking to somebody who teaches computer coding, and he was saying that he saw a big difference in his class when he just switched his first slide in his presentation from, let me tell you why this is important, to asking this as a question of the room. Why is this important? Can you tell me the reasons why it is? Because then the people in the room got to have their voice heard around why this is important. And it was coming from them, and then they could feel a greater sense of autonomy rather than him telling them why it was important. And he got all the answers he was looking for if he'd asked the room, but it came from them as opposed to being told to them. And he said the whole day was different when he does that. He gets much more kind of buy-in and agreement and participation from the class if he just does that one little change. I can't promise that it works everywhere, but it's probably worth doing. Sometimes we also see learned helplessness. Is anybody familiar with this research with the dogs? Nope. This is obviously not a real picture from it. This is just my little sketch. But this was some research. It's kind of unpleasant. It was done. It was Marty Seligman and some other people where they would take dogs and they would put them on an electric plate and give them shocks. So I know, right? It's not nice. I don't think they were very bad, but it was unpleasant. And the dogs would go nuts and try to get out. But eventually, if they keep doing it long enough, the dogs will just accept that they're going to get shocked, and they'll stop trying to get out. And you can even take the barrier away, and they'll still just sit there and continue to get shocked. So the term for this is learned helplessness, right? I'm getting the unhappy face. I hate it's fascinating, but really unpleasant. But I see this in organizations. We tried to do that before, and they wouldn't let us. We tried to do that before, and it didn't work. We tried to do that before, and the system never kind of came together, or they didn't support it, or they didn't do these things. So whenever you hear people expressing I can't do that because it hasn't worked in the past, they've been sitting on the electric plate for a while. And the problem is they're not wrong. They did try to do the right thing in the past, and they did get punished for the behavior, either through not being supported or actively punished for it, potentially. So what do you think is going to convince the dog can get off the plate? Yeah, motivating the dog. The dog's probably going to have to experience that it can now get off the plate and have a positive experience that they can do it. I'm stretching the dog thing a little bit, but one of the things with learned helplessness is you can't just tell them that it'll be okay this time. It's going to be different this time. I know we've had these initiatives in the past, but this one's going to be different. What do they have to do? How do we have to convince their elephant that it'll be different this time? Yeah, the elephant really has to see it being different. They have to have that experience. So that's one of those kinds of things where if you have learned helplessness, this is a tough problem. It's hard to undo it. And really one of the only things that's going to undo learned helplessness is having some successful experiences with the new thing so that they actually start to kind of believe that they're not sitting on the electric plate getting shocked anymore. Negative prior experience or shame. I always think these exercise pictures are hilarious because when I exercise, I do not look like this. I'm doing some work actually with some groups that train personal trainers, and one of the problems with personal trainers who, help people with their exercise stuff is personal trainers are entirely people who like exercise enough that they want it as a job. And they're dealing entirely with an audience who dislikes exercise enough that they have to pay somebody to help them with it. So there's a bit of an empathy gap Just saying. And so one of the things, the skills that they need to learn is almost kind of being a therapist for people about exercise. Because people who are paying personal trainers, sometimes it's because they're a good athlete and they want to be a great athlete. That's fine. Those people we have no problem with. But the people who don't exercise, so they hire a personal trainer, they have to deal with the fact that they've actually had a lot of shame around failing in the past. And so this person is going to need to help them really kind of get past their whole set of negative associations with it and start to find ways to actually like doing it and things like that. Which is a whole new skill set for personal trainers. They don't get trained in that right now, but it starts to become part of the issue. And then lack of identity or value alignment is a big one. If something, it's easy to change maybe knowledge, it's a little harder with skills and attitudes, but the foundational things like culture, core values, personality, those are some of the hardest things to change for people. And so if they feel like a change doesn't align with their values, you have a problem. And somebody asked me this question in a workshop: how do you get people to change their values about the environment or saving the environment? And I said, well, changing values is real hard. So I say, don't do that. Figure out how to show them how the behavior aligns with their values. Don't try to change their values. So one of the most interesting cases of this was in Texas. Everybody knows about Texas, right? It's kind of, a certain culture in the US. And they had the biggest problem with littering in like the 80s and 90s was this sort of demographic that they were looking at. 18 to 35-year-old males would litter quite a lot, throw beer cans off the back of the pickup truck or whatever. And so when they created the material around an anti-littering campaign, they didn't want to talk about saving the earth or green or any of these things. Instead, they created a campaign called Don't Mess with Texas, which fit very well within their cultures and values, right? They're very proud of being Texans. They're very tough, and so they got famous Texans to do the TV commercials and talk about Don't Mess with Texas. And the end result is it's credited with reducing litter on Texas highways roughly 72% between 1986 and 1990. So instead of trying to change your values about the environment, you should care about the environment because little green plants and stuff, they instead aligned it with the values that people already had and had a much bigger impact on the behavior change at that point. And then things like emotional arousal, impulse control. I'm going to skip over that one. Misaligned incentives and mistrust. So those are all things. Misaligned incentives, you guys have those problems in enormous numbers. People are not being incented for the right behaviors. Sometimes people don't trust the change because they don't really believe in the answers behind it. And I won't speculate about that for your group. But when we come back to it, what I do when I'm actually working on one of these things is I go through this list and I see which ones of these apply, because they're going to have different things that I need in the learning experience if I'm trying to address it, depending on what the issues are for a particular behavior change or a particular behavior in terms of coming up with a strategy for that. So I think that's it. Yes, and we can make a copy of the slides available to people and things like that. And you do have a copy of this list in your book. So, all right, thank you.